Hello everyone, I am Dr. Vaibhav Thakkar. I am heading the Department of Public Health Dentistry at MGM Dental College and Hospital. So today I will be discussing with you all about Dean's Fluorosis Index. So there are different indices that are used to measure fluorosis. Out of that, the most commonly used is the Dean's Fluorosis Index, which was given in the year 1934. Thilstrup-Fezesco Index of Fluorosis, which was given in the year 1978. Then we have the Tooth Surface Index of Fluorosis, which was given by Horowitz et al. In the year 1986. And then we have the Fluorosis Risk Index given by Pendries in the year 1990. And lastly, we have the ICMR Index of Dental Fluorosis given in the year 2013. Other descriptive indices that may be used along with these indices are the DDE, that is also known as the Developmental Defects of Enamel, the Jackson-Alauzi Index, or the Murray-Shaw Index. Talking about the Dean's Fluorosis Index, it was given in the year 1934. Trendley H. Dean was the person who devised this index to assess the presence and severity of mottled enamel. Now, Dean's Fluorosis Index, which was given in the year 1934, it had 7 categories which range from normal, questionable, very mild, mild, moderate, moderately severe, and severe fluorosis. Now in the year 1942, Dean modified this index and the scoring system, which ranged from 0 to 4, wherein normal enamel to severe fluorosis was considered and the moderately severe category was removed, and the scale was revised to a 6-point ordinal scale from the original 7-point. And this modified Dean's Fluorosis Index, which was given in 1942, is the one which is recommended by WHO in its basic survey manual given in the year 2013 as well. Now coming to the normal enamel, that is score 0 of the Dean's Modified Fluorosis Index. This enamel represents usual translucent semi-vitriform type of structure. The surface is smooth, glossy, and usually of a pale creamy white color, as can be seen in the picture. Next is questionable fluorosis, that is score 0.5. Now here the enamel discloses a slight aberration from the translucency of normal enamel, ranging from a few white flecks to occasional white spots. This classification is used in those instances where a definite diagnosis of the mildest form of fluorosis is not warranted and classification of normal cannot be justified. Next is score 1, that is very mild fluorosis. Now in this, what we can see is there is opaque paper white area scattered irregularly over the tooth but involving less than 25% of the tooth surface. It also includes the teeth showing 1 to 2 mm of white opacity at the tip of the summit of the cusp of bicuspids or second molars, as it is seen usually. Next is score 2, that is mild fluorosis. Now here the white opacity of the enamel of the teeth is more extensive than the previous category but covers still less than 50% of the exposed tooth surface. Coming to the next score, that is moderate fluorosis, that is score 3. Now here, as we can see in the picture, the enamel surfaces of the teeth are subject to attrition and they show marked wear. And all surfaces are usually affected, and brown stain is a frequently seen disfiguring feature in this score. And the last score is severe fluorosis, that is the most extreme form of fluorosis which can be seen, and here all the enamel surfaces are badly affected and hypoplasia is so marked that the general form and anatomic structure of the tooth may be affected. There are pitted or worn areas and brown stains which are widespread, and the teeth often have a corroded appearance. So that was about the different scores that we can have in the Dean's Fluorosis Index. Now let us see what is the scoring criteria. Now in Dean's Index, it results in a single score for an individual. So what we have to do is we have to give a single score after observing all the teeth. If fluorosis is present, the individual will be scored based upon the 2 most affected teeth in the oral cavity. And if the 2 teeth are not equally affected, the less affected tooth is scored. Remember that the examinations have to be made in a good natural light with the subject facing the window or the source of the light wherever possible. Instruments that will be usually required to measure this index will be mouth mirror and a simple probe. Now what are the advantages of using this Dean's Fluorosis Index? It is very simple to use. As you all can see, there are different categories of scores that we have to give. It is universally accepted. Attempts to validate visual appearance against the histological defect are seen, and it is the most sensitive of all fluorosis measuring indices that are present. Coming to the disadvantages or the limitations of this index. Now remember, here we record only the 2 index teeth, so it does not measure the extent of defects on the remaining teeth. And the score gives no idea of location or surface involved. and isolated defects cannot be recorded through this index. Distinction amongst categories is not very proper, and teeth are examined wet and that may overlook minor opacity. So these are few of the disadvantages of the Dean's Fluorosis Index. So to summarize, Dean's Fluorosis Index, it is the most widely used index to measure dental fluorosis, and it still remains the one of the most recommended index for recording fluorosis by WHO in its basic survey manual as well. These are the references that we can read more about this index from. Thank you.